All right, now I'm going to be reviewing some manipulation techniques for the head and the neck. And so I'm going to be going through some muscle energy and HVLA kind of techniques. I almost always will do some muscle energy techniques prior or sometimes after I do a little bit of HVLA, just because if we pop it back but we don't fix the myofascia, then the problem tends to kind of recur. And so if we want the problem to go away, then that's where we need to make sure that we're addressing the myofascia simultaneously. And so I tend to diagnose from more of a sitting position, but I like to treat from a standing position just because I feel like I have better motor control over how I'm going to be kind of holding the head. So I'm going to be just checking his OA here, okay, and his OA is side bent left, rotated right. So I'm going to be standing up, okay, and I'm going to kind of get a little bit of traction right over here. I'm going to try to, so the OA doesn't have a lot of motion, so that's enough just to kind of lock out his OA right here. Okay, I'm also making sure that I don't kind of cup his ear so he can hear what my instructions are. Because if I want him to do muscle energy, I can say, gently go ahead and try to bring your head back towards the midline right over here. So I kind of have it locked out. Go ahead and do that right for me. And relax. And remember with muscle energy, there's no winner. Push again for me. Relax. Okay, and then I got the pop right there. And so I got his OA, but I also got a couple of the upper cervical simultaneously with that. I'm a big lever person, so the hand that I had right over here, my cephalad hand right here, that was more of my fine motor control, and then my hand I had cupped underneath here, which I had, if I show it on this side, I kind of have their head cupped just with my hand, so I have control of the arm here. That's more my gross motor hand, so I have a long lever and short lever. So my short lever is just kind of my fine motor kind of tuning to make sure I'm getting right to the vector, right to that specific spot. And the short lever is, or the long lever is going to be the one that I can essentially just kind of whip his head. So as I'm doing it, I'm trying to kind of get that kind of motion so I don't have to do just one big hard motion just with one hand. So it's a simultaneous kind of thing like that. And remember, it's high velocity, low amplitude, so not a lot of motion. Okay, so that was just to treat the OA. If we're treating the AA, then I'd like to bend him up. Again, get him a little bit beyond that 60 degrees, and I kind of bring him back down to 60 degrees. And then I just check their motion. Okay, he's actually pretty good here. I don't really feel any AA restriction that he has, but saying that I needed to do an AA kind of treatment, again, I would keep my hand on the head right over here. So I have that. So long lever is down here, short lever. I'm going to be coming across, again, not covering up his ear, but kind of right along the jawline, just so I have a little bit of fine motor tuning. So I could essentially just get it just with my bottom arm, just doing this. But I just kind of bring it right up to the barrier. If I need to do muscle energy, again, go ahead and try to push yourself back towards the middle here. Relax, and remember, not a lot of force that they need, just to engage the muscles around it. Relax, okay, and then if I need to, just a little thrust like that. So just a little thrust to be able to get that little axial joint right over there. Okay, and so that would be for the AA. Okay, lastly, let me kind of go over some of the upper cervicals. To treat the upper cervicals, okay, so that is where they're, because of the way that the facets align, it's going to be rotated and side bent to the same direction for almost all those or not almost, all those segments, just because of the way the facets are aligned. And so if it's rotated left, it's going to be side bent left. If it's rotated right, it's going to be side bent right. Okay, when we're doing this, if I'm trying to do the upper ones, and when I talk about the upper ones, I'm talking about C2 down to probably C4, and then once you get into C5, 6, 7, then it becomes kind of a lower one. So the typical upper ones, C2, 3, 4, tend to favor a little bit more rotational rotational kind of emphasis when we're doing it. And you can also do a side bending emphasis. One of the biggest things I think that makes a big difference with this is, here, hang on to the spine right over here for me. So if I'm trying to do a rotational emphasis, okay, think about a bridge, okay? A bridge has, a bridge is a very stable structure, and it has that keystone kind of part of it at the top of the arch, and that's super stable. So if a ship kind of crashed into the bridge right there, that bridge tends to usually be pretty resistant to kind of falling apart just because you've kind of bent it up over there. So it really kind of isolates it there. If I have the spine straight, so a straight road, and then the ship kind of crashes into the side, I try to rotate it, then that bridge can really kind of shake a lot. If I have the arch made, then it really isolates it right there. So along those lines, when I'm doing a rotational emphasis, the first thing I'm doing is locking out that sagittal plane. Again, we're using Fryette's laws, and so we're trying to use that third law of motion in one, restriction of motion in one plane will restrict motions in the other planes. So that way we can really lock it out to that segment. Okay, so when I'm trying to do the uppers. Okay, and let me feel here. So I feel C2 right over here. It does feel like it's rotated left side at left. So what I'm doing is I take my index finger and I have it on the articular pillars of the spine here. I'm going to lift up just on C2. So I'm just, extending it just over that. So it's not hyperextension, it's just extending just that segment. Then with my bottom hand, which is going to be my right hand, because it's rotated left side at left, so I need to rotate them to the right. So I'm going to be kind of cupping the head, moving it over to the right. And that's why I like to stand, because I'm going to reposition my body a little bit over here so I can stay kind of in front of my arms. Okay, so I have it extended, rotated right. I'm going to side bend it left, just because if I try to side bend it right, the way that the sets align, I lose my barrier. So again, I want to kind of get it here, right over here, rotate up here, and then just a little thrust again. So I have the thrust and the counter thrust. Okay, so I have the big thrust here, fine motor kind of thrust right over here. So that would be if I'm trying to do a rotational emphasis. Now, if I'm trying to do side bending emphasis, okay, so let me find that a little bit lower on them here. Okay, and I feel C6 is kind of rotated left side, that left, right down over here. Okay, so again, coming back to our bridge analogy. Okay, so now I want to actually be able to have that something crash into the bridge and actually be able to kind of get that from a side bending kind of emphasis. And so from a side bending emphasis, that's where I want to flatten out the curve so that I can actually knock the peg, through. And so if it's side bend left, rotate left, I need to try to knock it over to the right. And so that's where I'm going to find those articular pillars right over here. I'm going to flex him forward until I've kind of straightened out the spine right over here. Rather than use my index finger, I tend to use the base of my second finger right over here. So the base of my index finger, and I kind of rest that right along that articular pillar right over here. So on C6, I'm going to side bend it until I kind of have it locked over here, and then I'm going to rotate it to the left again, just to use that third Friet's law, just to lock it out better. And then just a little thrust there, so a little bit thrust down this way, thrust over that way. So that's the side bending emphasis. And if I wanted to do muscle energy from this place right over here, okay, I can set it up here and I can say, awesome, just go ahead and try to straighten your head back towards the middle. Okay, so go ahead and do that. And relax, and I can take them a little bit more to a barrier. So if you feel something's tightening up on you, you can always do muscle energy, and you can always do muscle energy in lieu of just doing HVLA as well. So that is treatment of the lower cervicals.